Across the United States, a familiar foe has returned. This foe, known for its distinctive violent cough, has been a part of human history for centuries. Despite advancements in modern medicine, it has found a way to resurface, challenging our healthcare systems and communities. Whooping cough, a highly contagious respiratory illness, is making a comeback. This disease, also known as pertussis, is caused by the bacterium Bordetella pertussis. It spreads easily through the air when an infected person coughs or sneezes, making it a formidable opponent in densely populated areas. This isn't a new disease. We've known about it for centuries. Historical records show that whooping cough has been a significant health concern since at least the Middle Ages. Over time, it has claimed countless lives, particularly among infants and young children, who are most vulnerable to its severe symptoms. Yet, in 2024, we're seeing the highest number of cases in a decade. This alarming trend is not just a statistical anomaly. It reflects deeper issues within our public health infrastructure and vaccination programs. The spike in cases has prompted urgent calls for action from healthcare professionals and policymakers alike. This surge is a stark reminder of the importance of vaccination and public health. Vaccines have been our most effective tool in combating whooping cough, drastically reducing its incidence since their introduction. However, vaccine hesitancy and misinformation have led to gaps in immunization coverage, allowing the disease to resurface. We live in a modern world of advanced medicine. Our hospitals are equipped with state-of-the-art technology, and our scientists are continually making breakthroughs in understanding and treating diseases. Despite these advancements, the resurgence of whooping cough highlights the limitations and challenges we still face. Antibiotics and vaccines have saved countless lives. They are the cornerstone of our fight against infectious diseases. Antibiotics can treat the bacterial infection, while vaccines can prevent it from taking hold in the first place. However, the effectiveness of these tools depends on widespread public acceptance and adherence to vaccination schedules. But the resurgence of whooping cough reminds us that our battle against infectious diseases is never truly over. We must remain vigilant. Public health campaigns and education are crucial in ensuring that people understand the importance of vaccinations and the risks of complacency. We must continue to learn, understand, and protect ourselves and future generations. By staying informed and proactive, we can safeguard our communities against the resurgence of whooping cough and other preventable diseases. The health of our children and the well-being of our society depend on our collective efforts to maintain high vaccination rates and robust public health measures. Whooping cough, also known as pertussis, announces itself with a set of distinctive symptoms. It often starts like the common cold. You might experience a runny nose, sneezing, and a mild cough. But then, the cough intensifies, morphing into something far more sinister. These aren't your average coughs. They come in violent, uncontrollable fits. These fits can last for minutes, leaving the sufferer gasping for air. This desperate gasp often produces a whooping sound, giving the illness its name. Whooping cough is highly contagious. It spreads easily through the air. When an infected person coughs or sneezes, tiny droplets carrying the bacteria are launched into the environment. These droplets can travel up to 6 feet. If you inhale these droplets, you can become infected. You can also get infected by touching your mouth or nose after touching a surface contaminated with the bacteria. This could be anything from a doorknob to a toy. For many, especially adults, whooping cough might seem like a bad cough. But for others, it can be devastating. Infants and young children are particularly vulnerable. Their immune systems are still developing. Whooping cough can lead to serious complications. These include pneumonia, a lung infection, seizures caused by a lack of oxygen to the brain, and apnea, where breathing repeatedly stops and starts. In severe cases, whooping cough can even be fatal. Section 5. Shielding ourselves. In this section, we will explore the various measures we can take to protect ourselves and our loved ones from the threat of whooping cough, also known as pertussis. We are not powerless against whooping cough. Through a combination of medical advancements and everyday practices, we can significantly reduce the risk of infection and spread. One of the most powerful weapons we have at our disposal is vaccination. Vaccines have been proven to be highly effective in preventing a wide range of infectious diseases, including whooping cough. The pertussis vaccine is highly effective at preventing the disease. It works by stimulating the body's immune system to produce antibodies that can fight off the bacteria that cause whooping cough. It's usually given as part of the DT-TAP vaccine for infants and young children. This combination vaccine also protects against diphtheria and tetanus, providing comprehensive protection for our youngest and most vulnerable. Older children and adults can receive a booster shot called Tdap. This booster is crucial because immunity from the initial vaccine can wane over time, making it necessary to reinforce our defenses. In addition to vaccination, practicing good hygiene is crucial. Simple actions can make a big difference in preventing the spread of whooping cough and other respiratory infections. Wash your hands frequently with soap and water. This helps to remove germs that you may have picked up from surfaces or through contact with others. Cover your mouth and nose when you cough or sneeze. Using a tissue or your elbow helps to prevent the spread of droplets that can carry the bacteria. And if you're sick, stay home to prevent spreading the infection. By isolating yourself, you protect others, especially those who may be more vulnerable to severe illness. Remember, protecting ourselves from whooping cough is a community effort. By getting vaccinated, practicing good hygiene, and staying informed, we can all contribute to a healthier, safer environment for everyone. A global uprising. Whooping cough is not just a problem in the United States. It's a global health concern. The World Health Organization estimates that there are over 140,000 reported cases of whooping cough worldwide each year. Many of these cases occur in developing countries with limited access to healthcare and vaccination. But even in developed nations like the US, we're seeing a resurgence. This is partly due to waning immunity from childhood vaccines and a decline in vaccination rates in some communities. The power of vaccines. Vaccines are one of the greatest public health achievements in history. From the early days of smallpox inoculation to the rapid development of COVID-19 vaccines, the journey of vaccines has been remarkable. They have played a crucial role in eradicating diseases and improving life expectancy. They have saved millions of lives and continue to protect us from deadly diseases. Diseases like polio, measles, and diphtheria, which once caused widespread fear and mortality, are now largely under control thanks to vaccines. The shield of immunity they provide is invaluable. The pertussis vaccine is a testament to this success. Pertussis, also known as whooping cough, was a major health threat, especially to young children. The introduction of the pertussis vaccine drastically reduced the incidence of this disease. Before the vaccine was introduced, whooping cough was a leading cause of death in children. The disease would cause severe coughing fits, making it difficult for children to breathe and often leading to fatal complications. Thanks to widespread vaccination, cases plummeted. The dramatic decrease in whooping cough cases is a clear indicator of the vaccine's effectiveness. Children who once faced a high risk of severe illness and death can now grow up healthy and strong. However, the recent surge in cases highlights the importance of maintaining high vaccination rates. When vaccination rates drop, the community's immunity weakens, allowing diseases to resurface and spread. This resurgence serves as a stark reminder of the ongoing need for vigilance. When enough people are vaccinated, it creates herd immunity, protecting those who can't be vaccinated, like infants. Herd immunity acts as a barrier, preventing the spread of disease and safeguarding the most vulnerable members of our society. By getting vaccinated, we contribute to the health and safety of our entire community. Beyond the horizon. The fight against whooping cough is far from over. We need to remain vigilant. We need to continue to monitor outbreaks, track vaccination rates, and educate the public about the importance of prevention. Researchers are also working on developing new and improved vaccines that provide longer-lasting immunity. And we need to address vaccine hesitancy, ensuring that everyone has access to accurate information about vaccines and their safety. A call to arms. The resurgence of whooping cough is a wake-up call. It's a reminder that infectious diseases are still a threat. But it's also a call to action. We can't afford to be complacent. We need to work together to protect ourselves and our communities. Get vaccinated, encourage others to get vaccinated, practice good hygiene, and stay informed about public health recommendations. Together, we can combat this preventable disease and create a healthier future for all. Vaccination. Get vaccinated. The pertussis vaccine is highly effective in preventing whooping cough. It's typically administered in combination with other vaccines, such as DT-TAP, diphtheria, tetanus, and pertussis. Follow the recommended vaccination schedule. The Centers for Disease Control and Prevention, CDC, recommend a series of DT-TAP vaccinations for children under the age of 7. Get booster shots, such as Tdap, tetanus, diphtheria, and pertussis, are recommended for adolescents and adults to maintain immunity. High-risk groups. Infants under 1 year. Infants under 1 year are at the highest risk of serious complications from whooping cough. Ensure that all caregivers and family members are up to date on their vaccinations. Pregnant women. Pregnant women should receive the DAP vaccine during the 3rd trimester of pregnancy to protect themselves and their newborns. Young children. Young children should receive the DTaP vaccine according to the recommended schedule.